Your body needs the right support to manage diabetes effectively. But did you know that certain vitamins can actually help lower blood sugar levels and protect you from serious complications? Most diabetics are walking around with critical vitamin deficiencies, and this could be making their condition much worse. Today, I am going to tell you about the three most important vitamins every diabetic should consider taking, backed by science and clinical experience. This video is for information purposes only. It is not medical advice. For any health concerns, please consult a qualified doctor. Diabetes is not just about high blood sugar. It is a metabolic condition that affects how your body processes nutrients, absorbs vitamins, and maintains cellular health. When you have diabetes, your body becomes less efficient at using and storing essential vitamins. This happens because high blood sugar levels interfere with nutrient absorption in your intestines. Additionally, frequent urination, which is common in diabetes, causes your body to lose water-soluble vitamins at a much faster rate than normal. Over time, these deficiencies can lead to nerve damage, poor wound healing, weakened immunity, and increased risk of heart disease. But here's the good news. Supplementing with the right vitamins can help you manage blood sugar better, reduce inflammation, and prevent long-term complications. The key is knowing which vitamins to take, how much to take, and why they matter specifically for diabetic health. Let me start with the first vitamin that every diabetic should seriously consider. Vitamin D is one of the most important nutrients for blood sugar control, yet it is also one of the most commonly deficient vitamins in people with diabetes. Studies show that up to 70% of diabetics have low vitamin D levels. This is a major problem because vitamin D plays a direct role in how your pancreas produces insulin. Insulin is the hormone that helps your cells absorb glucose from your bloodstream. When you do not have enough vitamin D, your pancreas struggles to release insulin properly. This leads to higher blood sugar levels and makes it harder to keep diabetes under control. Research has shown that people with higher vitamin D levels have better insulin sensitivity, which means their cells respond more effectively to insulin. Vitamin D also reduces inflammation in your body. Chronic inflammation is a hidden driver of insulin resistance, which is the root cause of type 2 diabetes. By lowering inflammation, vitamin D helps your body use insulin more efficiently. This can lead to better blood sugar readings and reduced need for medication over time. In fact, several clinical trials have demonstrated that vitamin D supplementation can lower fasting blood glucose levels and improve hemoglobin A1C, which is a marker of long-term blood sugar control. Another major benefit of vitamin D is its role in protecting your heart. Diabetics are at a much higher risk of developing heart disease, and low vitamin D levels increase that risk even further. Vitamin D helps regulate blood pressure, supports healthy blood vessels, and reduces the buildup of plaque in your arteries. This makes it essential for long-term cardiovascular health. Studies have found that people with adequate vitamin D levels have lower rates of heart attacks, strokes, and other cardiovascular events. Your body can produce vitamin D when your skin is exposed to sunlight. However, many people do not get enough sun exposure, especially if they live in areas with long winters or spend most of their time indoors. Darker skin tones also produce less vitamin D from sunlight. This is why supplementation becomes necessary for most diabetics. Age also affects vitamin D production, with older adults producing less vitamin D from sun exposure compared to younger individuals. The recommended dose of vitamin D for diabetics typically ranges from 1,000 to 4,000 international units per day, depending on your current levels. However, it is important to get your vitamin D levels tested before starting supplementation. Your doctor can check your blood levels and recommend the right dose for you. Taking too much vitamin D can lead to toxicity, so always follow medical guidance. Vitamin D toxicity, though rare, can cause calcium buildup in your blood, leading to nausea, weakness, and kidney problems. You can also get vitamin D from certain foods like fatty fish, such as salmon and mackerel, egg yolks, fortified milk, and fortified cereals. However, it is difficult to get enough vitamin D from food alone, which is why supplements are often necessary. A 3-ounce serving of salmon provides about 450 international units of vitamin D, which is helpful but often not enough to correct a deficiency. Now let me move to the second critical vitamin for diabetics. Vitamin B12 is absolutely essential for nerve health, energy production, and red blood cell formation. Unfortunately, many diabetics become deficient in this vitamin, and the consequences can be serious. One of the main reasons diabetics develop B12 deficiency is due to a medication called metformin. Metformin is one of the most commonly prescribed drugs for type 2 diabetes. It works by lowering blood sugar levels and improving insulin sensitivity. However, long-term use of metformin interferes with the absorption of vitamin B12 in your digestive system. Studies show that up to 30% of people taking metformin develop B12 deficiency over time. The longer you take metformin, the higher your risk of deficiency becomes. Low B12 levels can cause a condition called peripheral neuropathy, which is nerve damage that leads to tingling, numbness, and pain in your hands and feet. This is already a common complication of diabetes itself, and B12 deficiency makes it much worse. Many diabetics suffer from severe nerve pain without realizing that a simple vitamin deficiency could be contributing to their symptoms. The nerve damage caused by B12 deficiency can become permanent if not addressed early. Vitamin B12 is also crucial for producing red blood cells. When you do not have enough B12, your body cannot make healthy red blood cells, leading to a type of anemia called megaloblastic anemia. This causes extreme fatigue, weakness, shortness of breath, and difficulty concentrating. For diabetics who already struggle with low energy due to blood sugar fluctuations, B12 deficiency can make daily life much harder. Some people describe feeling so tired that they cannot complete basic daily tasks. Another important role of vitamin B12 is in protecting your cardiovascular system. B12 helps break down an amino acid called homocysteine. When B12 levels are low, homocysteine builds up in your blood. High homocysteine levels damage your blood vessels and increase your risk of heart attack and stroke. Since diabetics already have a higher risk of heart disease, keeping B12 levels adequate is critical. Elevated homocysteine is an independent risk factor for cardiovascular disease. Vitamin B12 also plays a vital role in brain health and cognitive function. It helps maintain the protective covering around your nerves called the myelin sheath. Without adequate B12, this protective layer breaks down, leading to problems with memory, concentration, and mood. Some research suggests that B12 deficiency may contribute to depression and cognitive decline, which are already more common in people with diabetes. The recommended daily intake of vitamin B12 for adults is about 2.4 micrograms, but diabetics, especially those on metformin, may need higher doses. Some doctors recommend 500 to 1,000 micrograms per day for people with deficiency. Vitamin B12 is available in different forms, including tablets, sublingual lozenges, and injections. Injections are often used for people with severe deficiency or absorption issues. You can find vitamin B12 in animal-based foods such as meat, poultry, fish, eggs, and dairy products. However, if you follow a vegetarian or vegan diet, or if you have absorption problems, you will likely need a supplement. Fortified cereals and nutritional yeast are plant-based sources, but they may not provide enough B12 on their own. A serving of beef liver contains over 60 micrograms of B12, making it one of the richest sources available. It is important to get your B12 levels checked regularly if you have diabetes, especially if you take metformin. A simple blood test can reveal whether you are deficient. Do not ignore symptoms like tingling in your extremities, fatigue, or memory problems. These could be signs of low B12, and early treatment can prevent permanent nerve damage. Some doctors recommend checking B12 levels at least once a year for people on metformin. Now let me discuss the third essential vitamin for diabetics. Vitamin E is a powerful antioxidant that protects your cells from damage caused by high blood sugar. When your blood sugar is elevated for long periods, it creates harmful molecules called free radicals. These free radicals attack your cells, blood vessels, and organs, leading to complications like kidney disease, eye damage, and nerve damage. Vitamin E neutralizes these free radicals and reduces oxidative stress in your body. This is especially important for diabetics because oxidative stress accelerates the progression of diabetic complications. By taking vitamin E, you can help protect your blood vessels, nerves, and organs from long-term damage. Oxidative stress is one of the main mechanisms through which diabetes causes complications throughout the body. One of the most significant benefits of vitamin E for diabetics is its ability to improve insulin sensitivity. Research has shown that vitamin E supplementation can help your cells respond better to insulin, which leads to better blood sugar control. This is particularly beneficial for people with type 2 diabetes who have insulin resistance. Some studies have shown improvements in fasting blood sugar and insulin levels after several months of vitamin E supplementation. Vitamin E also supports heart health, which is crucial for diabetics. High blood sugar damages the inner lining of your blood vessels, making them stiff and narrow. This increases your risk of atherosclerosis, heart attack, and stroke. Vitamin E helps keep your blood vessels flexible and reduces inflammation in the arterial walls. It also prevents the oxidation of LDL cholesterol, which is the bad cholesterol that contributes to plaque buildup in your arteries. Another important benefit of vitamin E is its role in eye health. Diabetic retinopathy is a leading cause of blindness in adults, and it occurs when high blood sugar damages the blood vessels in your retina. Vitamin E protects the delicate blood vessels in your eyes and reduces the risk of vision loss. Some studies suggest that vitamin E, combined with other antioxidants, can slow the progression of diabetic retinopathy. The retina is particularly vulnerable to oxidative damage because of its high metabolic activity and exposure to light. Vitamin E also supports your immune system. Diabetics are more prone to infections because high blood sugar weakens immune function. Vitamin E enhances the activity of immune cells and helps your body fight off infections more effectively. This is especially important for preventing slow-healing wounds and infections in diabetics. Foot infections, in particular, are a serious concern for diabetics and can lead to complications, including amputation, if not properly managed. The recommended daily intake of vitamin E for adults is 15 milligrams, but some diabetics may benefit from higher doses, especially if they have complications. However, it is important not to take excessive amounts of vitamin E without medical supervision. Very high doses can interfere with blood clotting and increase the risk of bleeding, especially if you are taking blood-thinning medications. Doses above 400 international units per day should be discussed with your doctor. You can get vitamin E from foods like nuts, seeds, vegetable oils, spinach, broccoli, and fortified cereals. Almonds, sunflower seeds, and hazelnuts are particularly rich sources. However, many diabetics do not get enough vitamin E from diet alone, which is why supplementation can be helpful. 1 ounce of sunflower seeds provides about 7 and 4 milligrams of vitamin E, which is nearly half of the daily recommended amount. When choosing a vitamin E supplement, look for natural forms like D-alpha tocopherol rather than synthetic forms like DL-alpha tocopherol. Natural vitamin E is more easily absorbed and utilized by your body. Always check with your doctor before starting vitamin E supplementation, especially if you are on blood thinners or other medications. Natural vitamin E has been shown to be almost twice as bioavailable as synthetic forms. It is also important to understand that vitamins work best when combined with a healthy lifestyle. No supplement can replace a balanced diet, regular exercise, and proper blood sugar management. These vitamins are meant to support your overall diabetes care, not replace it. Think of them as tools that help your body function better and protect you from complications. Exercise, for example, improves insulin sensitivity on its own and can enhance the effects of these vitamins. Many diabetics make the mistake of relying solely on supplements without addressing the root causes of their condition. If you continue to eat a diet high in sugar and processed foods, do not exercise, and do not monitor your blood sugar, no amount of vitamins will fully protect you. The best results come from a comprehensive approach that includes medication, diet, exercise, stress management, and supplementation. Stress, in particular, raises cortisol levels, which can increase blood sugar and counteract the benefits of supplementation. Also, remember that not all supplements are created equal. The supplement industry is not as strictly regulated as pharmaceuticals, so quality can vary widely between brands. Look for supplements that are third-party tested and certified by organizations like USP, NSF, or Consumer Lab. This ensures that the product contains what it claims and is free from harmful contaminants. Some supplements have been found to contain fillers, heavy metals, or incorrect amounts of active ingredients. Another key point is that you should never start taking high doses of vitamins without consulting your doctor. Even though vitamins are natural, they can interact with medications and cause side effects if taken incorrectly. For example, high doses of vitamin E can increase bleeding risk, and excessive vitamin D can lead to calcium buildup in your blood. Your doctor can help you determine the right doses based on your individual needs and health status. Regular blood tests are essential for monitoring your vitamin levels. Do not assume you are getting enough vitamins just because you eat a healthy diet or take a multivitamin. Diabetics have unique nutritional needs and absorption challenges, so testing is the only way to know for sure. Ask your doctor to check your vitamin D, B12, and other key nutrients at least once a year. Many insurance plans cover these tests, especially when there is a medical reason such as diabetes or metformin use. If you are newly diagnosed with diabetes, starting these vitamins early can help prevent complications before they develop. Prevention is always easier than treatment. By supporting your body with the right nutrients from the beginning, you can maintain better blood sugar control and protect your organs, nerves, and blood vessels. The first few years after diagnosis are critical for establishing good habits and preventing future problems. For those who have been living with diabetes for many years, it is never too late to start. Even if you already have complications like neuropathy or retinopathy, these vitamins can help slow the progression and improve your quality of life. The key is consistency. Take your supplements daily, follow your doctor's advice, and stay committed to managing your diabetes holistically. Many people report feeling more energetic and experiencing less pain after correcting their vitamin deficiencies. In addition to these 3 essential vitamins, some diabetics may also benefit from other nutrients like magnesium, chromium, and alpha-lipoic acid. Magnesium helps with insulin function and blood sugar regulation. Chromium enhances insulin sensitivity. Alpha-lipoic acid is a powerful antioxidant that can reduce nerve pain. However, these should be discussed with your healthcare provider to determine if they are appropriate for you. Magnesium deficiency is common in diabetics and can worsen blood sugar control. Remember, managing diabetes is a lifelong commitment. It requires daily attention to your diet, physical activity, medication, and overall health. But with the right support, including proper vitamin supplementation, you can live a full and healthy life. These 3 vitamins, vitamin D, vitamin B12, and vitamin E, are some of the most important tools you can use to protect your body and keep your blood sugar under control. Do not wait until complications develop to take action. Start today by talking to your doctor about testing your vitamin levels and adding these supplements to your routine. Your future self will thank you for taking these steps now. Diabetes is a serious condition, but with knowledge, discipline, and the right nutritional support, you can manage it successfully and avoid the worst complications. So if you like this video, please like and subscribe for more videos like this.